Okay, well, we'll get started. We have a wonderful panel today to discuss the continuing humanitarian healthcare crisis and needs in Ukraine. I would just say that we have assembled a group here that I think can give very useful updates to the community here. This particular webinar is sponsored by the Heal Ukraine group, which is a group of Ukrainian American physicians and their supporters here who are both informing the community about healthcare in Ukraine currently and also providing training for Ukrainian physicians here at Mass General and Brigham and Women's Hospital. And I'm just going to introduce Dr. Nelia Melnichuk, who is a senior surgeon here at Brigham and Women's Hospital. Nelia, take it away from here.
Yeah, thank you, Mark. So yeah, just a little bit of introduction about us and what we do. I'm Nelia Melnichuk, colorectal surgeon at Brigham and Women's Hospital, but also founder and president of an organization called Global Medical Knowledge Alliance, whose focus is to improve quality of medical care in Ukraine through education, data analytics, and quality improvement programs. We have been actively involved in Ukraine even before the war has started. As you can hear from my accent and from my last name, I'm Ukrainian, and I have been working in Ukraine on trying to improve cancer care in Ukraine. And then since the war has started, we expanded our focus to surgery, tactical medicine. We were providing Ukrainian physicians with humanitarian aid and medical supplies as a part of Heal Ukraine group. And also we have been providing Ukrainian physicians with access to observerships through our Harvard system, through Harvard Scholars at Risk at Heal Ukraine group. We have trained so far 31 physicians in our system of different specialties. We have surgeons, oncologists, transplant surgeons, transplant medicine physicians, and we are trying to help Ukrainian healthcare with the acute needs, but also focusing on a longer term rebuilding and figuring out what they will need in the future, how to continue healthcare in a war setting and after, and what we can do to help. And one of the things that we have been doing is actually increasing awareness among our community about what's going on in Ukraine, especially at the beginning of the war. We had many webinars and a lot of interest from the community about how they can help. But obviously, as with any other events, as the war continues, there is less and less interest to it, but the needs actually not decreasing, but maybe actually increasing. So we want to make sure that we keep talking about it and figuring out how we can help. And we are already grateful to our community with all the help that they have provided, but we want to keep the conversation going. And we are very grateful to all of our speakers today who will be able to give us an update on healthcare situation in Ukraine and what we can do to help. Mark, do you want to do the introduction?
Yes, so I thank you very much, Nelly. And yeah, just to second the support we've had from philanthropists, families of philanthropists that have made the training of Ukrainian physicians here at Mass General and Brigham and Women's possible, and then obviously the partnership between Heal Ukraine Group, GMKA, and also the Scholars at Risk program at Harvard University that really, without all of that support, we wouldn't be able to do what we're currently doing. So our first speaker up is Alexander Vindman. He's former Director for European Affairs for the US National Security Council, a retired US Army Lieutenant Colonel, I should say Lieutenant Colonel, sorry, that's my British piece of it. And just to say that we're very, very grateful and honored to have you on to talk about this current state from your perspective of healthcare challenges, unmet needs in Ukraine. And also, if you could give our audience a little bit of your background. You're known to many people for a number of reasons, which will go unspoken at this particular meeting, but nevertheless, we'd be happy to hear that, as well as your perceptions on current challenges for healthcare in Ukraine and where you see the needs and how they can be met. So thank you, Alex.
Sure, thanks, Mark. I think most people recognize me from my appearance on Curb Your Enthusiasm, is what you're referring to. But no, seriously, I'll keep it relatively brief and pass off to my colleague, Mark Arnold, who's the executive director for my nonprofit that we relatively recently established, doing a bunch of interesting, very, very impactful work in Ukraine, especially in the medical sphere. My background, I'm a former policymaker, senior policymaker. I was a director on the National Security Council, pretty lofty position, the equivalent of an Army 3-star during my tenure there. Forced out of government service, but looking to serve in other ways. I finished up my doctorate at Johns Hopkins last year in December on the topic of US policy towards Russia and Ukraine since 1991. It's the subject of my second book. I've been involved in philanthropy in Ukraine since the beginning of the war. I've raised about $13 million. The vast majority of that actually went to medical care in Ukraine, in a space that actually is generally very inaccessible. There are a lot of humanitarian initiatives, a lot of donors, especially early on standard fare humanitarian efforts, for civilians, in civil society. I was focused on the gaps. I was focused on how do you provide the same quality medical care, same quality equipment for the military. So I was able to leverage my notoriety to channel about $8.5 million towards an NGO that was providing care at just about the point of injury. We call it the casualty collection point. It's the first place where casualties from the front lines are pulled back to, where they're accessible, and then could be drawn back to the next level care to stabilize them, and eventually to hospitals, which is the bulk of the treatment. Is that this is a very developed country with pretty impressive medical care, especially for the military, but it comes through the civilian hospital system in a lot of cases for really serious treatment. So I did that. Also done projects around extreme cold weather gear for the military. And the big project that we have underway that Mark is leading is around training combat medics. And I don't want to blow it for him, so I'm going to let him talk about it. But training combat medics, the entirety of Ukraine's combat medic corps, 27,000 to Western standards, and the impact that'll have, he'll cover. In addition to that, because I was a policymaker, I still have it in my blood. I write about this topic regularly. I forecasted this next year for Ukraine as quite difficult. I started writing a Substack with a pretty decent followership. So if you're interested in what that forecast looks like, it's just going to be a very challenging year based on the fact that the prospects for really major gains by the Ukrainians in terms of liberating occupied territory are not great. They lack equipment, they lack logistics to sustain offensive operations, and frankly, they lack some training in the way to orchestrate combined arms warfare to achieve effect, to be able to penetrate Russian defensive lines and really kind of maneuver in Russian rare areas to liberate large territories. So you'll see more of this kind of plugging away at each other, attritional warfare, which the Russians have some advantages in because they have an advantage in artillery. Lots of the casualties, as your colleagues know, originate from shrapnel wounds from artillery and mortar fire. That's frankly the bulk of the injuries. The Russians outgunned the Ukrainians significantly, especially as the Russians have plussed up their access to North Korean ammunition, have increased their own defense capacity to do this work, while Western provision to Ukraine has diminished, is dwindling, and really quite precarious, especially if another Ukraine supplemental is not passed by Congress. So that's something that you've probably seen me talk about. Maybe some of you have seen me talk about in the news media space, writing about it regularly. It'll be a tough war on that basis. Still heavily plugged in with the national security establishment in the U.S., drawn back into be an outside expert consultant. Let's say that sounds too formal. So the White House basically convenes a bunch of former policymakers to tell us about all the good things that they're doing and solicit advice from us. I participate in those meetings through my think tank. I engage with the White House and Congress on this topic, and I've had several trips to Ukraine to both get a better beat on how the war is going and reconnect with the senior most echelon of Ukraine's policymaking community, the entirety of the national security community, to be able to provide some advice, to carry some messages forward back to the US and so forth. So very, very, very engaged on the topic of helping Ukraine win this war, primarily because I recognize the impact on US national security. I have roots in the region. I was born in Ukraine. I came to the US when I was a 4-year-old in 1979. But I really am mainly concerned as a former Army officer on the impacts of US security, regional stability, and the geopolitical landscape with a Russian victory, Ukrainian defeat, what that means for US security. Anyway, I think that's the big picture. Mark is going to dive deeper on our work and his visits to the region. Really glad to be able to join the call and be able to answer some questions.
Yeah. Alex, thank you so much for your insights. Mark Arnold, if you could tell us again a little bit about your background. You're a retired US Army Brigadier General, about your background and your involvement in helping in the healthcare situation in Ukraine, and again, what you see the progression from where we were in February of 2022 all the way to now, you know, in terms of the, you know, situation for the health and well-being of Ukraine. Thank you, Mark.
Okay, Mark. So yes, my background is 37 years in the US Army Reserve. Yeah, Brigadier General, but almost entirely in Special Forces assignments. And then my last assignment, I was the commanding general of the 100th Division, and one brigade out of my 4 brigades of 6,000 soldiers was entirely health services, meaning that brigade trained combat medics throughout their career. So all these different levels of training that a combat medic goes through during the entire career. I also was in corporate America for decades and ultimately was the CEO of a pretty large company that we IPO'd on the New York Stock Exchange. So I'm very familiar with running very large initiatives and large organizations. And lastly, in terms of my background and how it relates to Ukraine, when I retired for personal reasons, I went through my state's fire academies, firefighter course, EMT, and ultimately became a medic and served 5 years in a professional fire department. So I brought 5 years of EMS experience, pre-hospital medicine experience, to Ukraine. So I've been to Ukraine 4 times since the major invasion. Each visit I spend 4 to 6 weeks, and each visit, over half of that time, is at the front. I mean, at the front lines. And during my early visits, I engage with commanders. So as a retired brigadier general, I've got access to brigade commanders, battalion, company commanders, people in charge of 2,000 and 1,000 soldiers, and talking with their staffs as well. And likewise engaging with forward surgical teams, stabilization points at the front line with physicians. So during my first visits to Ukraine, unanimously, what I heard was from commanders and physicians was that over half of the Ukrainian soldiers who die of their wounds would have survived had all the medics been thoroughly trained. And it's not the Ukrainians' fault. 4 out of the 5 medical schools run by the military were destroyed early on in the 2022 major invasion. These are medical schools where physicians, nurses, and combat medics graduated each year and then went into the Ukrainian military. And at the same time, you've got the Ukrainian military, since the major invasion, growing from this size to this size and taking this many casualties, with combat medics taking far more than their fair share of casualties because of their exposure to combat. So I started working with the agency in Ukraine who is responsible for training medics, and it's the Ukrainian Military Medical Academy. And then their next higher headquarters, the Ukrainian Medical Corps. So for 3 or 4 months, I worked with them via Zoom meetings like this to help them develop a plan that would help them, that would result in them rebuilding their capacity to train medics. When I returned to Ukraine in May, I learned that of the amputation problem in Ukraine. And then I went back into lots of amputations of Ukrainian soldiers. When I returned to the United States last May, after spending 3 weeks at the front in Donetsk region, went full-time fundraising mode. In August, the chief surgeon for Ukraine joined one of my weekly Zoom meetings with the Medical Academy and Medical Corps, one, to thank me for what I'm doing, but also to share with me something that just shook me to my bones. He said that the majority of their limb amputations are avoidable. And he said, Mark, the problem is my medics are not converting tourniquets to pressure dressings, which is a fundamental medic skill. So then I returned to Ukraine in November, where the chief surgeon and I are both keynote speakers at the first medical conference in Ukraine since the major invasion. There he shared with me that the rate of avoidable limb amputations in Ukraine for the military is 70% because of not converting tourniquets to pressure dressings. And so there I am in Kiev, and I'm looking at the amputees more closely, and they're everywhere. But now I'm noticing that, yes, these amputees, they're amputated right here, and then right there, just distal to the hip area, which is where medics are taught, or soldiers are taught, to put tourniquets, high and tight. And the problem is, and I've got all these videos and interviews I could share with you today, but we don't have time, that the Ukrainians cannot evacuate their casualties from the front until darkness, because the Russians target all ambulances that are moving from the front to the stabilization points. And the stabilization point is typically about 1 hour drive to 2 hour drive from the front. And it's the first time that a physician has the opportunity to assess a casualty and treat the casualty. So if you've got amputees, if you have people with limb tourniquets on for 6 to 8 hours, as physicians, you know that irreversible compartment syndrome is set in, and these limbs have to be amputated. So the Ukrainian Medical Academy and Medical Corps have created a plan which is far beyond what I thought they could be capable of doing. And their plan is to establish 22 dispersed training facilities for combat medics and up to 10 mobile instruction teams, where 1/3 of the instructors are going to be Ukrainian physicians, most of them coming right out of medical school, and 2/3 being senior medics. And the Medical Corps is putting them through a 2-month program, 1 month to learn how to teach a curriculum, and the second month to observe them teaching the curriculum. And if they don't demonstrate proficiency in teaching the curriculum, then they don't become instructors. But they've got 42 instructors right now ready to go, and they've got their plan is to graduate 20 to 30 instructors every month for the remainder of this year. And the curriculum is a curriculum that I personally went through as an EMT because of school shootings and mass shootings. My fire chief wanted somebody good in tactical medicine. It's 94 skills, from something as fundamental as putting on a tourniquet and, yes, doing tourniquet conversion to a pressure dressing, to as sophisticated as surgical cricothyrotomy. And with physicians, I don't need to explain what that is. But these medics have to demonstrate proficiency in all 94 skills, and also have to demonstrate proficiency in doing it at night, in the dark, with a headlamp, in the weather. And it's not an easy course. Like, again, I went through it twice as a medic. And so I am supporting this, and Alex is supporting this through the Here Rights Matters Foundation through fundraising. And our budget, the Ukrainians' budget, is $2.3 million for all of the sophisticated mannequins. As physicians, you understand, cricothyrotomy mannequins, venous mannequins, tension pneumothorax mannequins, multi-system trauma mannequins, mannequins that medics can drag through the woods without destroying them. As Alex mentioned, so the objective here, and the Ukrainians believe it, with this capacity, they can achieve it, and I know they can, and that's to train all 27,000 medics in 94 skill sets in 12 months' time. And the medics who survive that 12 months will go right back and do the course all over again 12 months later. So, and I might add that when I returned from Ukraine in November, there's a US Navy admiral retired who was deputy chief surgeon for the US Navy. He reached out to me because he heard about me, and he said, Mark, here's a white paper that I co-authored with 2 Ukrainian physicians in September of 2023. And it's all about the amputation problem. And the upshot of their white paper was over 75% of the casualties where tourniquets were applied never needed tourniquets in the first place. And when I shared with him that 70% of the amputees are avoidable, he said, yep, that sounds just about right. Then he brought my attention to one last fact that I'll share with everybody, is that the British Army, the historians, published a report, I'd say August, September of 2023, where the number of amputations that have occurred in Ukraine during the first 6 months of 2023 were on par with all of the amputations of the entire British Army during all of World War I. So this medic training program can't happen quickly enough. And this is all about preventable, this is prevention. It's also about preventing deaths, and is also including the improving the probability of functionality of these limbs once the casualties are in a physician's care. So thank you, Mark, for the opportunity to share this program with you and your colleagues.
Well, I'm going to hand over to Lesia to just comment on this and also introduce our Ukrainian physician speakers as well.
Yeah, thank you, Mark, and thank you, Mark, both Marks. No, I mean, we definitely see the same thing from all conversations with our Ukrainian colleagues who are part of GMKA and our advisors. I think the person who you're talking about who wrote the white paper is Alexander Vindman, who is a trauma surgeon in Ukraine. He is actually a member of advisory board on GMKA, and he's the one who is guiding us to produce educational materials in this regard. We are the ones who translated ATLS into Ukrainian and now distributing it widely among Ukrainian surgeons and medics and anesthesiologists. And the same thing with guidelines from deployed medicine, we're doing that as well. But definitely the problem with tourniquets and the problem with amputees in Ukraine it's just heartbreaking, because it doesn't have to be. There's obviously casualty that we cannot prevent. There is mortality that we cannot prevent. But if there is something that we can prevent, the morbidity that we can change both through education, that just hurts that it doesn't happen soon enough. So I am on board, and in any way we can help, just let us know, because we also see, so this is, Mark has been talking more about the acute care of those soldiers. We also see a lot of issues with education when those soldiers get treatment in the tertiary care centers and other hospitals in Ukraine with wounds, with wound management, with management of bowel injury, with management of different kind of long-term injuries. So we see similar kind of thing there as well. We don't have that data, like Mark said, that 70% of amputations can be avoided, but definitely through education we can improve that care there. And I really want to give a word to Lesia Strilka, who is a burn surgeon in Ukraine, who sees both adults and kids with burn injury. And as you know, Russia bombs cities indiscriminately. Lots of lots of injuries in civilian population, and Lesia has been treating mostly kids but adults as well with burn injuries, so she can give us a little bit of update on what kind of injuries she sees, what kind of problems she sees there. She's right now spending 3 months with us here at Brigham, MGH, and Children's Hospital to learn a few different skills that she can bring back to Ukraine, but she can also give us an update what's going on there right now. So Dr. Strilka, if you're able to talk about some of your experiences, that would be great.
Good afternoon to everyone. I'm sorry a little bit because I'm sitting in a hall in MGH hospital. A little bit about me. My name is Lesia Strilka, and before, as we call it in Ukraine, big war, before February 22, I was working in Kyiv in birth center, and burn center in Kyiv has been admitting like injured soldiers from the front line since 2014. So I have had some experience of wound burn and wound management, but I never could imagine such tremendous number of patients. I mean, civilian injured civilians, a lot of soldiers, and even more children. And it's hard to tell you all of those terrible things, but I was forced to move to the western part in Ukraine, and now I'm working in Lviv with kids, and really in 21st century, and it's hard to imagine that people with injuries after missile attack, with fractures, amputations, burn wounds, and soft tissue defects, and everything, those terrible thing in one patient, in one 14-year-old kid, 15-year-old, 8-year-old, all ages of like children. And first months, Ukraine got a lot of humanitarian aid, a lot of supplies, medical equipment from other countries, from European countries, United States, Canada, and others. But and we are very grateful to all of you about this support. But after like first stage of shock, we realized that we need more knowledge because we don't have experience how to. We never faced with those everything in one day, in one time, in one place, a lot of injured patients, but also we keep having patients with diabetes, with cancers, with and for example, for you, just information for you. For example, in Lviv, since after full-scale invasion, number of patients in pediatric hospital grew more than 3 times in a month. So that means that we have lack of supplies, we have lack of medical staff, especially medical staff, we have lack of knowledge, and we can't stop our country, and unfortunately we can't stop this terrible war. And I am very grateful for those initiative, all of you who works for Ukraine, who find some, who do some missions, for example, like I am staying in the US, and I can see how everything must be, but also I have an opportunity to to ask advice the best plastic surgeon, burn surgeon in the United States, I mean in the world, and all of them are very open-hearted for us, and all of them I ask about the most valuable for me is connection. It's like a new contact. It's opportunity to, when I will be in Ukraine, this is opportunity to ask somebody for advice, to know that I have those doctors, those people who can help me with some complications, with some difficult cases, because we had patients, at least one time in a week, we get trained from the Eastern Ukraine with like transfer with injured civilians, military, sometimes children, injured children. It depends on situation. It depends on situation on the front line. But also we keep working with long-term consequences from, injured children, injured patients, because all of them, for example, I'm a burn surgeon, and also I work like reconstructive surgeon and plastic surgeon. So first of all, I manage burns, wounds, but after that they go back to the hospital with scars, especially on faces, and some scars restrict their movement. So I should manage all these things. And now I think that we should maintain some balance between I mean, like, not advice for you, but like some proposal to maintain some balance between supplies, medical equipment, and knowledge, because just supplies and medical equipment, it doesn't work, because a lot of doctors in Ukraine, they don't know what to do with all those supplies and with all those, for example, dressings and a lot of interesting things and very useful things. But so we need knowledge and some trainings, knowledge, education, and to maintain this balance. That makes sense. But unfortunately, we don't have evidence of economic growth. So unfortunately, I think that we will need your support so long. It's pretty sad, but I don't want to be so pessimistic, because we can't give up. We should fight. We should survive. We should take care about our patient. We should take care about ourselves. We should get the knowledge. We should do everything for victory.
Thank you, Lesia, so much for this inspiring talk, and thank you so much for what you do in Ukraine. This job is very, very difficult, and especially in the environment of Ukraine. And thank you actually for coming here and learning, and we would be happy to support you going forward with access to specialists and advice and things like that. I wanted to introduce our next speaker, who is Dr. Arkadii Vodianyk. He is infectious disease specialist and works for WHO Ukraine. He also was an observer here through our program through Harvard Scholars at Risk, and brought some of also connections and new knowledge back to Ukraine that through WHO he's disseminating in Ukraine. So maybe Arkadii can give us kind of his overview of situation in Ukraine and things that we can help with.
Thank you very much, Nelia, for the introduction and for organizing this webinar. So today I'm connecting from Kyiv, and the only reason that I'm able to connect to this call is that during last 2 weeks, Kyiv experienced attack of over 300 missiles that were 95% of them were hit by US Patriots and German system IRIS-T and other air protection, air defense systems. And currently there is as such called in Kyiv as in Boston, and over 100 healthcare facilities can be functional and operate now in Kyiv, also just because the air was properly protected during the last 3 weeks, and they have electricity and heat and everything else that requires to provide healthcare. So I think when we think of enabling factors for provision of quality healthcare, it's not about medicine, it's not about training, it's also about other things that we haven't been considered as essential healthcare before 2022 and full-scale invasion in Ukraine, but now it's absolutely critical for being connected to this call and also for provision of healthcare. Talking about the trends and changes maybe in the healthcare in perspective of ongoing war, I think it's important to mention, and I would like to highlight this, is the understanding of healthcare providers and healthcare system that there is a high probability that the war will be not long but very long, so it's will be a marathon, and this understanding and this these dynamics bring a lot of challenges to the response and to the strategy that should be applied. I think a lot of process and a lot of issues that healthcare system faced were addressed by the enthusiasm of healthcare providers and their strength to and mobilization to work extra hours, to work without any rest, and using the limited resources to save as many patients and as many lives as possible. But when we talk about years and years, it's not possible to work only with the enthusiasm. So there are need of sustainable solution for a lot of process, starting from the education, ensuring the access to healthcare and enough healthcare providers to ensure this continuous provision of quality healthcare. Also, we observe the reduction of the quantity of the humanitarian support that is provided to the healthcare facilities comparing to the first months and year of war. And if previously some of the needs of healthcare facilities were fully covered by the humanitarian support, now the expenditures of healthcare facilities, they increase while the overall budget is the same or less. So I think that this is a growing challenge for a lot of healthcare facilities. I think, like, closing this part, I would like to mention the very famous phrase that if you would like to go fast, you shouldn't go alone, but if you would like to go far, you should go together. So, and this partnership and support between healthcare facilities in Ukraine and abroad, between healthcare providers, is really needed to be able to withstand this marathon that we are facing now. Another thing that I would like to mention is the number of unique challenges that healthcare system face during this ongoing war. So there are a number of problems that can be fixed, and we know how to fix them. For example, Mark was referring to the tourniquets and the kind of mistakes that can be avoided, but also there are a number of issues that we actually don't know how to address, like, for example, ensuring the proper infection prevention control measures while hospitalization of hundreds of patients during 1 hour, and then need of transportation of this patient between various healthcare facilities during a few days. and growing threat and growing burden of antimicrobial resistant pathogen that cause those infections that we actually do not have treatment to effectively treat infections. And then we have all of these wound issues and continuous problems with the healing the wounds, but also sepsis that patients experience, etc., etc. And I think it's important that Ukraine not just only receive the support and advice, but also is and Ukrainian healthcare facilities, but they should be active in participation on how to develop these new solutions for things that require these solutions and how to share them. So to not to be the passive recipient, but the active collaborators in those challenges that we face. So I think that sharing of experience and be like proactive in this, I think this is something that we are not very active in, but need to be more proactive. I think that in general, initiatives that is leading by Mark and Nelia with observership in the United States, they're really helpful to see the best practices and then bring them to Ukraine. And there is no notion that we need to postpone the reforms and changes. We need to introduce them now. And I think this is a very timely initiative, and it was very helpful for my personal development and professional development as well. And I would like to end with a gratitude that this webinar is taking place, because I think it's very important to keep this topic up on agenda, and really huge thanks to Mark, Nelia, and all other speakers for keeping this topic up. Over from my side.
Thank you very much, Arkadii. I have a sort of a general question for the group, which is that, you know, how is the systematic sort of almost government ministry, health ministry led approach, given that we're, you know, approaching 2 years into the war, where, you know, how much of this is bottom up and how much of this is top down in terms of reorganizing healthcare services for this marathon, as you describe it, Arkadii? And maybe we could have Lesia and Arkadii talk to that first, and then Alex and Mark from their perspectives and their interactions with Ukrainian government around that, because it seems like it's a very large task and is sort of a national sort of challenge as well. So maybe Arkadii first, and then Lesia on sort of the top-down management of this very, very difficult situation.
Yeah, I think that there are a number of bottom-up initiatives, so some like breakthroughs at the local level that some of them were picked up and disseminated around the country. Some of them were not so successful in the dissemination. And I think that bringing to the light the best practices and champions and the best solutions in terms of the wound care or organization of the process on how to admit so many patients at one time, this is something very important. On the other hand, I think one of the key enablers for provision of healthcare in Ukraine is that government of Ukraine, Minister of Health, and other national authorities were able to maintain the control and the governance of the whole system. So I think having this coordination is a key enabler and is a big also support for organizing all of the international humanitarian support that is coming to the country. So I think that this top-down approach is absolutely needed, and it is there. And I mean, the biggest room in the room is the room for improvement, but I think both initiatives are taking place.
Thank you, Arkadii. Lesia, what's your view on this?
Actually, I think that Ministry of Health consists of like literally bunch of guys who want to change something, who try to change something, but they there is also a lack of professionals who are very motivated, high motivated. So it's yesterday when I was thinking about this meeting, I was thinking that like your project, what you do, you take people, doctors and scientists from Ukraine, from different specialties, bring them to the US, or probably it might be to other countries, not only to the US or to some European countries, and they should be also high motivated, and after that they go back to Ukraine and they can, because our Minister of Health, they will support all good initiatives. So just they also need those people who will do it, who want to do it, who want to change something, not only work in the hospital and just waiting for Ministry of Health will do everything for them. So this war is not a war of our government or of our politics. It's war is like challenges for all of us. And so like to sum it up, that people from different specialties will go to Ukraine, and if they want, I know that if they want to do something new, to do something they could see here, for example, because very often a lot of doctors in Ukraine, they know that we do something wrong, and we know that we need to change something, but we don't know how exactly to change it, because we read some books, we could see some movies, but we heard about something from other doctors, for example, but we never seen it like in person. So uh, I can tell about me that I feel like very strong responsibility that I'm part of this project now, and when I'll go back to Ukraine, and I have a lot of idea, and I could see them here, and I have a lot of idea, and I'll try to change something, to implement them in Ukraine. So it's like you take doctors, invite them to the US, show them another world, like medicine world, totally another world, and all of them, they can all together they can change it in Ukraine, and I'm sure that Minister of Health will support them. They just, because politics, they have a lot of different tasks, a lot of different problems, and they don't want to solve all this problem. And for example, when we ask them, we need to change it, we need to change that, and they all the time they tell us that if you have something, just show it, just bring this idea to us, and even like on the paper, and we will support it. But you should do something also, not only sit and waiting for something will do it except us.
Yes. I got it. Lesia,
Or
thank
stand
you.
us.
I wanted to ask Mark your interactions with, top-down Ukrainian, in that healthcare arena. Do you find it's cooperative, it's active, it's, easy to work with? For example, the program that you're putting in place has to be intersect with I guess government and military organizations there.
Yes, so I started at the top. So I found out what agency in Ukraine was responsible for training medics, and it's the academy and the medical corps. They've had that responsibility for over 30 years. And they were very successful at it for many, many years, teaching this rigorous curriculum. I didn't bring it to them. They had it already. So I started at the top, but I must say though that we are doing bottoms up in terms of funding it. It's all coming from personal donations and a lot of hard work on the donor front. So, and I have to be quite candid also that Ukraine, whether it's the Ministry of Defense or the Ministry of Health or any ministry, there's a very, very thick bureaucracy in Ukraine. And it is hard work to cut through that, including the executives at the academy and the medical corps who have to work through their own bureaucracy above them. So it's best, my advice is go as high as you can and support those executives that support the program that you're trying, that they want in Ukraine, and do your best to help them and let them work through the challenges of their own Ukrainian bureaucracy. And I guess the success story we had on this is 6 months into fundraising and developing this this plan their plan to increase their capacity to train medics. During that journey, the Ministry of Defense fired the commanding general of the medical corps, which was just getting in the way. So that was good news.
Alex, your last words on that, and then Lesia, if you want to wrap the webinar up.
So reform and transformation is hard. It's exceptionally hard in a war. There is a kind of a ingrained way of doing business in Ukraine, and in certain ministries, it is really, really difficult to penetrate the bureaucracy. My experience is the newly formed ministries that have only been in effect over the course of the past, decade since 2014, are more agile, more willing to adopt transformational changes. Other ministries have kind of set protocols, and that's much more challenging. It doesn't help that it's also a state of war, and there is a deep risk aversion from a lot of folks with the kind of expertise to be able to travel to Ukraine, embed with the Ukrainians, and help them undertake that kind of transformation. That's something that's going to happen after the war is done. The question is, how do you do some incremental changes now? And the fact that this war is going to continue on for at least another year, likely longer, how do you help nurture those changes? So I think, one of the tools here is the power of the excellence in the U.S. medical field. It is very, very well regarded, especially from heralded institutions like Harvard, like all those New England institutions, medical institutions, having folks that are willing to go there and meet with leadership. And frankly, those connections are not necessarily hard to make. I think the senior Ukrainian leadership would be eager to connect, and have those kinds of conversations would be helpful. So you have a number of folks that are involved in this panel that are leaders in the area, in the nation, transferring some of that competency to Ukraine by going there and embedding with them for a little while would be very helpful.
Yeah, great. Well, I want to thank all the speakers. Really wonderful and important messages here in this, particularly to you, Mark, that philanthropy makes a huge difference here and makes programs possible that might not otherwise get started, and all that your work and Alex's work and Arkadii and Lesia's work is pretty amazing. Lesia, do you want to wrap up the webinar?
Yeah, so thank you all the speakers for American speakers for continue helping Ukraine, and obviously Arkadii and Lesia for everything you do in Ukraine, and we are there for you. We'll continue supporting you, and we are very grateful to Harvard community to supporting us and welcoming observers. And Alex and Mark, we hope we can help you in your work as well, disseminate at least the information about your work, and maybe we can collaborate as well. So yeah, thank you all. Enjoy the rest of the day, and we hope Ukraine wins soon.
Yes. Thank you.